One. Hey everyone, this is not another episode of the Edge podcast of CHRO. This is something very special that me and Nisha have decided to do. Normally, apart from a cadence, I think it's also a moral responsibility that Nisha and I carry for not just CHRs, but I think the general crowd to sort of help them educate on what basically can and cannot be done in times of COVID, especially with all the vaccinations and all of this happening. Some of the nuances I think greatly also have business impact, and I think that's where we've got a very special guest tonight. And I, personally want to thank this guest for taking the time out right now. So let me quickly introduce, and I think we can jump in right into the quick episode that we've planned. So, for maintaining the health of employees and family members during the COVID-19 pandemic, NPCI has tied up with Dr. Darrell DeMello, who's our guest tonight, as a health and wellness advisor. Dr. Darrell DeMello is an MBBS doctor with 30 years of experience. He has treated over 1,000 families during COVID. Doctor, please, I'd request you to introduce yourself as well.
Thank you so much. It's such a delight to be here with you, Varun, and with Nisha. I started with COVID or coronavirus in January of last year. It was a white space opportunity, and I jumped into it thinking that this could be a big thing. It was you put your gambles. I made my gambles, learned the disease, learned the things, came up with the strategy to treat, developed the whole treatment protocol, and the SOPs that go with the treatment, with the drug treatment protocol. Of course, came up with the whole idea that this was a clotting disease, this was an inflammatory disease, and this was a viral disease. So virus only is a terrorist in COVID-19, but the virus is a terrorist that incites and instigates the body to overreact. That overreaction of the body, the super overdrive of the body's immune response system, which then sets off what's called the cytokine storm. It's like a tsunami. That tsunami sets off clotting. So basically, you got to look at blocking clotting. So for me, I have approached this disease from day one last year, or from May 1 when I started treating as a clotting disease. So it was started with a 3-drug regimen, antiviral drug called ivermectin. I use it as an antiviral more about reducing the replication, preventing the replication of the virus. It's fantastic at denying a certain key element that the virus needs to replicate. So ivermectin became my drug of choice, based again on the paper that the Australians released in either late March or early April, where they said that one dose reduces the viral load by 99.8% in 24 hours. I give a 4-dose over 2 days regimen. So, after the dose of ivermectin, my theory has been, or my belief has been, that there's no live virus in the person. And I allow my patient to actually come out and mix with the family immediately after the 24 hours after the last dose of the ivermectin that I give them. The second one was the anti-inflammatory drug. I use a drug called colchicine, which is available in the country as Gautnil or Zycolcin, mainly to reduce the inflammation of the body. I call it my fire retardant, okay? It's fantastic at reducing the inflammation. It also causes the body to calm down. So there's no overdrive, there's no super overdrive, there's no over response. So anybody who's taken colchicine will realize that this drug really works well to calm the body down. So if you calm the body down and stop that over-inflammatory response, the additional extra super overdrive of the immune response system, you won't set up the clotting. However, to prevent that, I still give an anti-clotting drug. I started off using aspirin or Ecosprin in my first 200 cases. I realized I saw a lot of bounce back of platelets as we went into the second week. The platelet count bounced back to very high levels. And when you have excess platelets, you can have stickiness. That stickiness can cause clotting. So I ended up, picking the brains and talking to a cardiologist around the world. I picked the brains of a very well-known cardiologist, Bangalore boy from Cleveland, Ohio. And I actually had a chat with him and shared with him the idea that I wanted to use clopidogrel, which is D-Plat or Clopilat or whatever it is in India. In the US, it's called Plavix. I wanted to use Plavix as my anti-clotting drug. And since the case number 300, we actually started using these 3-drug regimen and really went with it. I've completed 6,000 cases as of the end of April this year. And I've had like 35 admissions, 14 deaths. And it's been a fantastic success. It's such a simple drug regimen I use. It's a very simple process I use. I do have strict rules that during the course of the disease, it's a 14-day disease. I want people not to eat certain foods. I want really soft foods, liquids. So I have a whole strength of SOPs that I follow, including tracking your oximeter reading, your saturation rates, your temperature, your pulse rate, 3 or 4 times a day. That's my only hard data is the oxygen saturation ratio. So for me, it became a matter of implementing what I learned, what I put together, and it is shown in the results. And the good news is that even though we had the first wave and now we have the variants, this regimen works fantastically well with the variants. I do not need to use steroids. I use steroids in really bad cases. I am very aggressive. I'll talk about some of my successes in some of the aggressive cases. But some of the things I've done has been the fact that I've been able to take people and stop them from clotting. So I use a drug called enoxaparin, which is a low molecular weight heparin, and I use that pretty aggressively in India. I initially started using it when it was 10 by 25. We're talking of CT scan severity scores of 10 by 25, 12 by 25. My biggest success was something with a 23 by 25 patient, where within the space of 24 hours, she was reverted from being a 23 by 25 down to a 16 by 25, sent home because no hospital was willing to admit her. I was able to take her back home after the second CT. I did 2 CTs the same day, found out she was 16 by 25. And enoxaparin did the job in a timely manner, took her home, and in 4 days, she was back to an oximeter reading of 99. So I've had good success. I also have success in cleaning up lungs from 15 by 25 to 0 within 30 days. I've attempted to do a 17 by 25. It takes a little longer. It takes 2 months to do that. So sometimes you have good success, sometimes you don't have that success. But my goal is to make sure the patient does not have damaged lungs or damaged organs in the long haul. So I don't want long haul patients. I want to treat them and have them perfectly normal, or preferably in 3 months. Ideally in 1 month, preferably in 3 months, and preferably in 6 months. I do not want long haul patients. We are very lucky in India that we have the availability of drugs and we have the availability of medications and the way we work. We have a lot of flexibility. We can treat really well. And for us, it's been just going out and making it happen. By the way, I use telemedicine for 90% of my cases. Out of my 6,000 cases, about 700 cases have been in home, in the same room where I'm talking to you, literally from the same place. I've had patients come and sit with me and kind of a diagnosis of COVID within 3 minutes, 4 minutes, treat them, and they're gone. I did lose a young girl, a young lady at 35. She had tested negative, RT-PCR test 3 times negative in 10 days, presented 86. She came home to visit me, it was 85. I brought her back to 90 odd, 92, 93. That night, her CT scan report came in at 20 by 25. I moved her to a hospital. Unfortunately, she passed away a day and a half later. Once the patient is out of my ambit or out of my control and into a hospital, I have no control of what happens to them there. So my control is when they're within me, within my control, within my treatment, I can do what I want and how I want and make sure that they recover. I've been aggressive, but I've been conservatively aggressive. And I will use drugs that are appropriate for that moment. I'm at the moment treating a couple at 12 by 20, 25, and 10 by 25, husband and wife. The mother had a higher amount and we admitted her. I couldn't mobilize her, but mobilization, proning, walking, especially on the days 8, 9, and 10 are very important also. And it's not just the drugs, it's also the mobility of the patient makes a difference. So there's a whole bunch of things that go into making sure you have success with patients. And
Got it.
my appeal to everyone is to treat this as a clotting disease, not treat it as a interstitial lung disease, because at the end of the day, you got to stop the clotting. If you can't stop the clotting, the patient's going to clot off and eventually die, and that's what it is. Right?
Yeah, doctor, I mean, this is, I think, Varun and I just are so happy that you're with us today, because I think this is such an educational episode really for the world's audience, I would believe, because we're talking hard facts over here. So I know, doctor, that you particularly have been helping a lot of corporates. You're talking to them about getting back to work, you're talking to them about their employees' well-being. And one of the important things that you have been doing, which a lot of people don't know about, is that you've been helping a lot of people continue even during the second wave, right? People
Right.
have been going to work even during the second wave. We just know that doctors are going to work or nurses are going to work. Probably all the essential services are functioning. But can you touch upon how you have helped, what kind of industries have you helped? Go back to work or really continue work, because this is not go back to work, they're just continuing to work, and people don't know, and this is one of their ways to kind of support their employees as well, and they have outsourced that entire mandate to you. So can you talk about how you've been running the sustenance campaign, so to say?
I've been running this campaign for two of the, and one is very key to the financial system of the country. Okay, NPCI is one of the financial backbone of the country, and of course, I've got a great team ahead of me in the task force that they have, and their management has bought into the whole thing of concept of we can't shut the company down. Period. If you shut the company down, the whole payment system stop in India. So with that mandate, then a lot of plans were put into place. A lot of simplicity of the plans were put into place, where certain things were done for them right from August, September of last year, where certain plans are put into place to build up their immunity over time. There's one thing that I tell everybody: get your vitamin D up, bring it up to 70, 60, above 60, less than 100. You will, when you get COVID, you won't even know you've had COVID. Okay, so that's the one thing I tell people. And of course, when they get sick, I treat them. And many of them, we pick them up on either quarterly screening, where we do a COVID antibody test, and we pick them up on a quarterly or a monthly screening, depending on their role in the organization. We sometimes do a monthly or a quarterly a blood test for them, where we pick them up. And those who actually get sick are treated by me with the therapy that I just laid out. So I get them back to work ASAP. The people who already had it without knowing they've had it, asymptomatically had it, we picked them up on the COVID antibody test, are most surprised. They're extremely surprised as to how they got it, and that they didn't know they got it. But that's the beauty of what we do. We put them on a certain program. I call it the Getting Back to Work program. I actually named it the prophylactic program, where I put them on certain blood tests and certain programs to do. And my God, it's really worked for at least three of the people that I work with, three companies I work with. So one's a hotel, which haven't had a case from July of last year till April of this year. And that company has done really well putting the program together. The other two companies are, like I said, the financial companies, where you can't shut down the backbone of our financial system. And so those two have worked really well. But again, I can work with management if management wants me to work with them. It goes two ways. Okay, management has to understand that this is not a line item in the HR budget. This is the cost of doing business. And what is the cost of doing business versus the cost of shutting down a business, or the cost of loss of business? So in these two companies, you can't shut down. You have no choice. You have to continue working. Okay, we've been able to actually do a damn good job of keeping them going, keeping the whole financial system up and running. It's shown in the results. My goal with them, with the companies I work with, is to make sure over time that their employees get COVID in a controlled fashion, the way I got it. I didn't know I had COVID. I was picked up on a COVID antibody blood test the day after Christmas, when my COVID antibody blood test came positive. And I deliberately exposed myself to patients. I deliberately do certain steps to keep getting the exposure, to build up the immunity. Now I'm at a pretty decent level on antibodies, so I'm not worried about what I do now. And it's the same thing I teach them. Many of them have antibodies of 80, 90, 130, 190. The highest I've seen is 1,200 antibodies, 1201. I mean, it's very high. But if that person was not under prophylaxis control, that person could have been in ICU and probably could have been dead. We're looking at the body's overreaction. So there's something that controls this, and it's about how you play the game and how you work with the system. Make sense?
It does. On that note, actually, right, one of the things that I think we'd all be interested to know is what the world would look like after the second wave. How can companies sort of plan, their way back to the office, again in a very safe manner, and essentially how can you be a catalyst to that, to management? I mean, I'd like to just go deeper into that part.
I'm actually talking to a number of companies. One's a logistics company based out of Bangalore. One's another payment company based out of Bangalore, Bombay. So we're talking to them about protecting all their staff, right down to the warehouse staff. When you're talking about logistics, you're talking about warehouses. So right down to the warehouse staff, we're talking about protecting them. We're in the final stages. Hopefully, we'll have an agreement this coming week, and they can then go out and sort of help launch the program across the country for their warehouse staff, for their logistics staff, where it makes sense for them to go with it. So it's kind of in the last stages where tomorrow we'll have probably one call and maybe a draft agreement on Monday or Tuesday, and we'll get going. But the reason is because, again, the MD of the company, his family was treated by me. It's all that personal relations that make a big difference. In every company where I've actually been able to launch this program, they've had the experience of working with me on somebody in their family being very ill, where we've actually brought them back to normal in a space of time, and it makes a difference. That personal relationship is a must for doing this thing. There's a lot of understanding of what needs to go into it and how it has to be done and all. Again, I'm not the only one who does it. The HR team in every company is my frontline force. They're the people who have to execute. I can give them all the plans, you have to execute. So whichever company you are in, it doesn't matter whether you're US-based, multinational, or if you're a consulting company, again, a US-based big consulting company who I'm talking to, or whether it's an Indian company that wants to get back to work. I'm happy to help everybody make this happen. Okay?
Hey, doctor. So one of the things that I think everybody would like to know at this point, I think, and before Nisha sort of, goes along with her question, is one, how can people get in touch with you if they'd like to? Two, in terms of the entire logistics of how you work, the kind of agreements that you'd need, the kind of cost, I mean, the kind of model you work on, either could be retainer, could be per visit, or anything that the nuances around that front. If you could sort of help, throw some light on that. I think anybody who would like to contact you could probably from our medium. I think we'd encourage that as well.
Yeah, the way people contact me would be either directly through my phone or WhatsApp, which you guys have. I'm taking space on a tech platform today to launch a Dr. Darrell DeMello virtual doc clinic. So that's a second way of reaching out to me. The main thing when we're doing prophylaxis and we're doing treatment programs with companies is it's an agreement with the company where their employees are protected, and the employees are protected to a certain extent that they are protected prophylactically. If they get sick, I treat them, and the treatment is based at a much discounted cost to what I would normally charge on an individual basis. So that's something I'm kind of promoting, that if you work with me on a retainer plus per patient cost, it makes great sense. So it's usually a retainer, and because I have to dedicate staff, I have to dedicate people, I have to dedicate resources to those companies. I can't do everything myself. I'm now in the process of hiring people to help me out. This last wave, I almost drowned. It was that heavy on me. I mean, I was getting 1,200, 1,400 calls a day. I can't take that. And I missed probably 80% of those calls I missed. And there was no way I can reach so many people. So we had to find a different way to make that happen. And I'm in the process of actually working through all the details to make that happen.
So I think the moment everything's ready, and I think the moment we've got all those hashed out as well, we'll be sharing all of those details, in our LinkedIn posts and all of our social channels, and also, in the description of this YouTube video as well. Feel free to reach out to Dr. DeMello anytime that you feel like, right? Thanks a lot. Nisha, your question.
Doctor, we've already, I mean, for a change, started preparing for the third wave. And, we want to know from you two things: your take on wave three, and also how can we avoid future lockdowns?
Okay. My take on wave three. Let's talk about wave one, wave two. We've had wave one, we've had wave two. We probably have about 15 to 18 to 20% of the population already infected with COVID today. For us to be able to be free of any worries, we either have to get 100% vaccinated. Okay. Still, it doesn't mean you don't have COVID. Vaccination will bring it down, will bring the severity down, the severity of the case down. Okay, that's number one. Number two, I'm looking at probably 15, 18, 20% per wave, and so we're looking at probably to get to 80, 90% to get herd immunity in the country. You're looking at about 5 waves. Okay, 5 waves will, 4 or 5 waves will see us through. We're through the second wave. We as a country love our festivals. We love our Diwalis, we love our Puja, we love our Ganesh Chaturthi, we love our everything, our festival. We are a festival-loving country. We love our gods. We love meeting our friends and family. We love celebrating. Unfortunately or fortunately, that celebration, that getting together is where these seeds are sown for infection. And you cannot, when you're in families, you cannot escape that. I had people come to me, whole families come to me. 2 families got together for Easter Sunday. Both families were sick. And 88 members of each family were sick. I've had families get together before Easter Sunday for something else, some other festival, and they were sick. So this wave, first of all, the variant or the virus now is a variant, is a mutant of what it used to be. So now it is a very transmissible virus. When I say very transmissible, meaning it can transmit very freely from one person to person. It's not something that's on fomites, on tables, or on door handles. All that, those stories are out. I'm on a myth-busting spree at the moment with different videos and all I've done. Okay, all that is history. It is direct transmission between people to people. And that's where I tell people, when you're out, you're in a grocery store, please wear your mask. Today, I did a vaccination drive with a company, and I can tell you, everybody wore double masks. And I commented about it. I commended them and commented about it. I said, thank God you guys took my advice. Every one of you are well protected. Double masks, they came prepared for the vaccination on one hand. So many women wore only like a one sleeve where you can pull it up, and the men wore t-shirts. So it's easy to vaccinate those people. So it's very easy when you have people comply with what you say. So it's just simple as that. The third thing is about being able to protect them in a way. We have people, we're talking of way by way. Today we protected them, but tomorrow, I've heard that, I read and hear about, children will get more affected. I think I've treated children in the first wave. I treated a lot of children in the second wave. I mean, there's no question about children, but children don't get affected. Okay, the virus being transmissible, highly transmissible now, but is less virulent, is less potent. So what's happening today, in today's case, what has happened over the last, since mid-Feb to now, is that patients tend to sit on their symptom. They deny that they have COVID. They think, I've just had a body pain. I'm just lethargic. I've just had malaise, and they miss the timeline. So you can't come to me as a patient and say, my oxygen saturation has dropped to 89 or 85 or 90, and I'm on day 3 of fever. Not going to fly with me. You've definitely, this is day 9 or 10. 8, 9, or 10 is when you have clotting. So this is an 8, 9, 10 story. Okay, so again, I try and work with the patient, but I assume it's an 8, 9, 10, and I start treating that way. There is nothing called shortened form of COVID. COVID is a 14-day disease. Okay, it starts on the first day, however mild the symptom may be, and it ends on day 14. Usually, if you are symptom-free by day 11, without any clotting, without any major thing, it's an uneventful 4 days, 11, 12, 13, 14. And ideally, if you come to somebody like me, day 1 to 4, your whole journey can be uneventful. Yes, you may have some nausea, you may have some diarrhea, you may have some body pain, but it won't be the kind of things that you have when you get clotting and you get all that. So it's a very different approach. Now, wave 3, I think will happen sometime in September, October, November. Those are the 3 months when we have all our festivals bunched together. That's the biggest potential we can have. It'll probably be a replication of last year. And we have September, October, November being the festival days where we'll have the wave. And it's about being careful. That the advice to people is to be careful, not to go out and behave like there's no tomorrow. Now, many of them would have already been vaccinated. Okay, many of them would have been used to going back to work now. So I'm looking at probably people starting going back to work starting next month or the month after that. So now the vaccination is in full flow. The mistake people made the first time around, that's why we had the severity of wave 2, was because many of the youngsters had thought to themselves, oh, my parents, my grandparents are already vaccinated, they're safe. And many of the people who got vaccinated thought they became Superman. You could fly out of the window. Because you've had 1 shot or 2 shots doesn't mean you're Superman. You need time to build up that immunity. And you can't suddenly go out and start behaving like I'm fully normal and I can go out and do everything and nothing will happen to me. They've got it. I've also seen patients come to me within 7 days of the vaccination. Whether they got it around the vaccination center or they lost control of themselves and they said, I've got the vaccination, I'm fine. Let me be a little bit more freer. And they've got, so those are some things we need to be careful of as we go forward, especially with regards to travel or meeting family or meeting friends and relatives and all. One wants to be careful about making those decisions to avoid a bad phase, a wave 3. We'll have a wave 3, we'll have a wave 4, we'll probably have a wave 5 till we hit the 80, 90%. After that, it's kind of a COVID will disappear. In my view, COVID will be gone by then. If you really want a timeline when I think COVID will be gone, I'm putting it on record here. I think we're going to have a long-term immunity for this. Whether it's 2 years or 5 years, I don't know. I'm projecting a longer than, today I'm talking to people about 16 months immunity. I think we'll have longer than 2 years, maybe as much as 5 years, maybe even longer, depending on how we are and see how that goes. Everybody's going to get COVID, whether you've had vaccination or not, whether you had normal COVID or not, you're still going to get COVID, even if you've had vaccination. So please continue your social distancing, you're wearing your mask, keeping your distance between people and your safety measures. However, you don't have to do the crazy things we did last year, which was washing our vegetables 10 times in hot water, soapy water, or putting packages away for 5 days and 4 days till the so-called virus died. The virus doesn't survive for more than a few seconds now on formats. So those are some changes I've made. I've made a lot of changes to my advice to my patients and my patient families. Make sense?
Lots. I think mind blown with information in under 30 minutes. I think
For
it's
sure,
one
yeah.
of our best episodes. Doctor, quickly, how can people get in touch with you? Do you want us to put out your WhatsApp number, or shall we put out the link? How should
Of your
we have
virtual
people?
clinic.
Yeah.
I probably will want the clinic being put out. Let them come through that.
For
It'll
sure.
save me a little. I'll also give you an office number, not my personal WhatsApp number, but an office number that they can reach out to. I do have a full-time assistant. I do have a full-time nurse now. I'm talking to a couple of doctors to join me. I have one doctor already in Bangalore who has partnered with me on this whole thing. We're talking to 2 junior doctors to join us. So we are ready to put together a team that can help companies come up with companies come to us and get the right treatment. So yeah, we are pretty much ready to roll from now on. Okay.
Awesome.
That's
Thank you.
brilliant. Yeah, I mean, yeah. So I think we're at the end of this quick session that we had with the good doctor here. Everyone, please be sure to check out all the details. If you feel the need to legitimately reach out, please do that as well. And in terms of the Eth podcast, yes, thank you again for the very first episode. The feedback that you guys gave us on it was super helpful. expect, as me and Nisha have mentioned on our social handles as well, accept an episode in your inbox every Monday and Thursday at 7 p.m. sharp for the next 2 months. We've built a pretty nice pipeline as well. In fact, we've also got one episode dedicated solely on understanding how frontline workers have coped up in terms of the HR policy and the compliances, especially in the last year and a half that we had. Doctor, I want to thank you again for being a part of this with us on such short notice. Nisha, again, fantastic co-hosting this stuff with you. Everyone, we'll see you very soon with another episode of the Edge podcast for CHROs. Thank you so much.
Thank you, Varun. Thank you, Nisha, for the invite. Thank you for having me. And I'm delighted to come here and answer any question or anything you guys want to talk about.
Yeah.
I think I do know this disease really well, and it's been pretty good so
For
far.
sure.
Thank you. Have a good night, guys.